It hurts to open a jar. So when it hurts to open a jar, this is sometimes the face that patients may make because it's so painful to grip something tightly with their hand. And usually patients will tell me that this pain is right at the base of their thumb, and they can really pinpoint one exact spot where it really hurts when they're gripping tightly or trying to do something like open a jar. When patients have this, it's very difficult to grip tightly or squeeze with the hand, and you'll feel as though your strength is lost because it's so painful to use that tight grip. So what this is usually arthritis at the base of your thumb. And that arthritis is more common in females, though it certainly happens with males also. And the main complaints are patients will have pain with gripping, pinching, or squeezing. And the reason why is at the joint where that thumb moves around kind of in a circumduction like that cartilage wears down over time. And so the smooth gliding surfaces at the end of the bone at the joint start to wear down. And then you start to get that bone on bone feeling of where those rough bone edges are grinding against each other. And so once that cartilage wears down, you start to get that bone on bone, as I'm sure most of you have heard. So this is an X-ray of the hand, and I'll just kind of see if I can show you here, but this is the joint where that thumb arthritis happens. And this is a normal X-ray. So you can tell that between this bone here and this bone here, there's a nice clear space where that cartilage is on this X-ray. And then I think when you compare it to something like this, where this red arrow is, you can see that there is no longer any space between these two bones. And you see this kind of this extra bone forming, and that kind of whiteness on the bone, that's hardening or sclerosis of the bone. And so that's when I get an X-ray in the office, it'll show me that there's that cartilage has worn down and that joint is more or less worn out. So conservative treatment. Luckily, conservative treatment actually works quite well for thumb arthritis, especially for a certain period of time, depending on how severe the arthritis is. The first thing I always try is bracing. And this is a brace that we carry in the office. You can also order it online, but it's a brace that it's made of neoprene, and it slides over your thumb, and it gives you some extra stability at that joint that is arthritic. And the brace helps because it takes some of the pressure off of that joint, and it also helps give you a little bit extra stability when you're turning a key, opening a door handle, opening a jar, that sort of thing. So I find that it can be pretty successful, especially in more mild cases of arthritis. Anti-inflammatories can be helpful. This is an inflammatory issue where as that cartilage wears down, your body tries to kind of make the surface of the bone glide smoother by sending more fluid and inflammatory cells to the area. So taking some anti-inflammatories like ibuprofen or naproxen or Advil or Aleve can be helpful. The other thing is doing activity modification. So that may involve, not gripping your golf club the same or your tennis racket the same. If you're working and it bothers you, kind of finding different strategies to optimize your grip without stressing that joint. And that's something that hand therapy can really be beneficial for, is kind of helping you find solutions to keep doing your job or your activity that you enjoy without pain. So I will frequently start off my treatment for thumb arthritis by sending patients to hand therapy to see if that can improve your symptoms. And then finally, kind of a little bit more invasive conservative treatment that does not involve surgery is doing a steroid injection to that joint. And again, a steroid is a powerful anti-inflammatory. And what I will do is, under a small X-ray machine that's very low radiation, I will insert the needle right into that joint. And so you can see that that needle is inside the joint here. Oops, sorry. And that will kind of direct the steroid right to the location where the arthritis is. And this is usually a temporary fix, though I would say that injecting the steroid directly to that area can provide some very significant relief in your symptoms. It's not going to make the cartilage grow back. It's not going to prevent the arthritis from worsening, but if it helps your symptoms and you're able to do the things that you enjoy without pain, and that injection lasts for 6, 12, 18 months, whatever it may be, I'm usually very happy continuing to inject that joint for as long as the injections keep working. So it's not uncommon that I have patients who have a very arthritic joint on X-ray, but the steroid injections may work well for them. And as long as they keep working, I usually tell you, keep going with the injections, and we will save the surgery kind of only if you really get to the point of needing it. So the steroid injection, with a steroid injection to this area, it's within the joint, it's not near a tendon. We can do it on a little more frequent basis, and I do not need to restrict like only doing 3 injections or something. Really, the thing is, as long as the injection continues to help, I'm happy to do it for this particular condition. Okay, so sometimes that arthritis is severe enough that conservative treatment will not be effective. So surgery, the way that I like to do it, it's an outpatient surgery. It is either general anesthesia or doing what we call a nerve block, which is where the anesthesiologist gives you an injection to make your whole hand and arm numb. And there are pros and cons to both of those. But it's done as an outpatient. You come in, have the surgery, go home the same day. And then after surgery, you're in a splint for about 2 weeks. And then after that, I send you to a hand therapist to be fitted for a custom orthosis. And the hand therapist and Ben do a really great job of making a brace or an orthosis that's comfortable for you, something you can take on and off to do your therapy exercises and for hand hygiene and all that good stuff. So this is a surgery that has a longer recovery than a lot of other kind of simple surgeries like trigger finger releases or carpal tunnel releases. So I do warn patients that it is usually at least 3 months until you're kind of back to normal and feel like you're getting the strength back. I don't expect you to have pain for 3 months, but I tell you that your thumb is not going to feel as good as you probably would like until at least 2 or 3 months after surgery. I think a lot of the pain from the arthritis is improved right away, but just some of the function of the thumb can take a little longer. And I'm not saying that it's not worth it to do the surgery. I think it's a very successful procedure, and patients have very good results. But I just try and be upfront with you and say, this isn't a slam dunk quick fix. You're feeling perfect by tomorrow. It takes some time to get better. So what that surgery involves is, if you look at the X-ray on the left, is I actually remove one of the small bones at the base of your thumb. And what that does is it creates more space within that joint, so the 2 bones are no longer rubbing against each other. So this is a little bit different than a total hip replacement or a total knee replacement, where they're putting different components into the joint. Luckily, your thumb doesn't bear weight similar to your leg. So we don't have to treat this by putting in metal prosthetics. And the other thing that this surgery involves is taking a portion of one of your tendons and reconstructing one of the ligaments kind of in this vicinity of your thumb that tends to wear out over time with this arthritis. And by reconstructing that ligament, we kind of optimize the position of your thumb and give you a better chance of kind of getting that full grip and pinch strength back after your therapy is completed. So like I said, this surgery takes some time to recover from, but I do think it is a very good option, especially once conservative treatment like bracing and steroid injections ceases to improve your pain. So I'd say, this is the main arthritis thing that we're going to talk about tonight. Arthritis is a very big topic. So I know there's a question about arthritis in the wrist. So for wrist arthritis, there's a lot of different forms of wrist arthritis. It depends on your age, your activity level, where the arthritis is, and there's definitely different options of, taking out some of the bones to make more joint space, fusing some of the bones so the bones don't grind against each other anymore. There are pros and cons to all of them, but I approach this very similar to how I just discussed with thumb arthritis, where once that arthritis starts, unfortunately, we don't have a lot of great tools to reverse the arthritis. We kind of have to just treat the symptoms of the arthritis. And I always start with conservative things like bracing, steroid injections, therapy. A lot of times these things will work for quite a while. And then when you do need a surgical procedure, chances are you've kind of come around to the point that wrist or thumb may not always be exactly the same. And it's just a little bit easier for you to mentally kind of be okay with doing the surgery. So, I think if there are more questions, I can try and reach out to you personally regarding your wrist arthritis. But there are pros and cons. There's a lot of different procedures that can be done for wrist arthritis, and it's honestly not one of the most common things. So I think as long as you're seeing a hand surgeon in the area, you're in good hands. And certainly if you have more questions, I can try and reach out to you on a personal level. So I hope that helps.